Today, we'll have a continuation of brief schizophrenia. I'm Dr. Peter Boakye-Boama, medical doctor and a resident in the psychiatry department, Kumasi, Ghana. My email is peterboakye27@gmail.com. Types of schizophrenia. 1. Paranoid schizophrenia. 2. Hebephrenic schizophrenia. 3. Catatonic schizophrenia. 4. Undifferentiated schizophrenia. 5. Post-schizophrenic depression. 6. Residual schizophrenia. 7. Simple schizophrenia. And 8. Finally, schizophrenia unspecified. Now let's look at them. The types of schizophrenia. The first one is paranoid schizophrenia. With paranoid schizophrenia, there is believed to be a target of harm. That is, the person believes some known or unknown people want to kill him or her by harming, poisoning, retarding their progress, or by stealing their natural powers. It is also characterized by the usual delusions and hallucinations, mostly auditory, where they hear voices other people can't hear. It is the commonest type of schizophrenia. 2. Hebephrenic schizophrenia is characterized by disorganized speech and disorganized behavior. Classic examples include masturbating in the middle of the road, smearing fecal matter on the ward or on medical personnel. 3. Catatonic schizophrenia. Catatonia is a state where a person is awake but appears unresponsive to their surroundings and is characterized by abnormalities in movement, behavior, and communication. Some features include posturing, mutism, immobility, and withdrawal. An example is refusal of food. 4. Undifferentiated schizophrenia. This meets the criteria, but no specific type predominates. For example, paranoid schizophrenia and catatonic schizophrenia are present in a person, but none of them dominates the other. 5. Post-schizophrenic depression. This happens after schizophrenia. There are still some few symptoms, which are residual symptoms of schizophrenia, present, but the depressive picture predominates. Residual schizophrenia. This occurs after an acute episode of schizophrenia that has psychotic features of hallucinations and delusions. At this stage, there are prominent negative symptoms with less marked or absent previously positive symptoms. It's characterized by the absence of prominent symptoms like hallucinations and delusions, but with the persistence or emergence of negative symptoms such as lack of motivation, social withdrawal, or blunted affect. 7. Simple schizophrenia. With simple schizophrenia, there are no delusions or hallucinations, but there are negative symptoms like apathy, which gradually arises with no acute episode. 8. Schizophrenia unspecified. Here, a person experiences psychotic symptoms like hallucinations and delusions, but doesn't fully meet the criteria for more specific schizophrenia subtype or another psychotic disorder. Now, clozapine. To look at clozapine, there are some terms you should know to understand what we are going to deal with. Some of these terms are agranulocytosis, which means dangerously low level of granulocytes, which is a type of white blood cells. Then extrapyramidal side effects, which are a group of movement disorders that can occur as a side effect of certain medications, particularly antipsychotics and other drugs that affect dopamine levels in the brain. Atypical antipsychotics, a class of medications used to treat psychosis and other mental health conditions that have fewer side effects. Tardive dyskinesia, a neurological disorder characterized by involuntary repetitive movements primarily affecting the face, mouth, and tongue, but can also involve the trunk and limbs. Now, neutropenia, a condition characterized by an abnormally low count of neutrophils, a type of white blood cells in the blood. Then boxed warnings. The FDA can issue this. It is the strongest warning that the FDA requires a pharmaceutical company, and it signifies that medical studies indicate that the drug carries significant risk of serious or preventable adverse effects. Clozapine. It is sold under the brand name Clozaril, among others. It was the first atypical antipsychotic to be discovered. It is used to manage treatment-resistant schizophrenia (TRS), which is the lack of response to two different antipsychotics, one of which must be a second-generation antipsychotic given in adequate doses for an adequate period of duration of 4 to 6 weeks. It is primarily used to treat schizophrenia and schizoaffective disorder. Clozapine reduces suicidal ideation and is recommended when tardive dyskinesia is present. Clozapine has also been used off-label to treat catatonia with a success of 80%. It is also recommended in some treatment guidelines as a third or fourth-line treatment for bipolar disorder. The mechanism of action. Clozapine mainly blocks D1 and D4 receptors, with less effect on D4 as compared to traditional first-generation antipsychotic FGs. Adverse effects of clozapine include the box warnings like neutropenia, orthostatic hypotension, and myocarditis. Common side effects include constipation, muscle stiffness, sedation, weight gain, drowsiness, hypersalivation, and blurred vision. For the serious side effects of clozapine, it includes agranulocytosis, seizures, and myocarditis. The mechanism of clozapine causing agranulocytosis is not fully understood, but is thought to be a type B idiosyncratic adverse drug reaction (ADR). Clozapine is also thought to cause gastric hypomotility. Examples of such include it manifests as fecal impaction, bowel obstruction, and ischemia. The central nervous effects of clozapine are written here. Clozapine also causes side effects like urinary incontinence, which is amenable to betanicol. Weight gain and diabetes are also common with clozapine use. Pneumonia has also been mentioned in clozapine use. Drug interactions. Clozapine interacts with fluvoxamine, which inhibits the metabolism of clozapine, leading to significantly increased blood levels of clozapine. Clozapine should not also be used with carbamazepine, as it's thought to increase the risk of agranulocytosis. As usual, our quote is protect your mind, for it is your home. Thank you very much.